Good morning, everyone. I'm Drenda Neiman, Health Officer for Lewis and Clark Public Health and your forum facilitator this morning. I'm also honored to chair the Lewis and Clark Behavioral Health Local Advisory Council. I'd like to begin by welcoming our honorable state legislators this morning, members of our local advisory council, advocates, and consumers of important behavioral health services. We appreciate your show of support and commitment to behavioral health services and systems improvement by attending this forum this morning.
Hello.
The forum is hosted by the Lewis and Clark Behavioral Health Local Advisory Council, or the LAC, which exists to help improve behavioral health services, both mental illness and substance abuse disorders, by reviewing and making recommendations for improvement at the local and the state level. The council is made up of a diverse cross-sector of representatives from agencies dedicated to behavioral health services and consumers of these services equally. In 2011, the Lewis and Clark Board of County Commissioners passed a resolution authorizing the creation of the Behavioral Health Advisory Council. From that date forward, the LAC's specific objectives have remained and include providing input and recommendations to the state of Montana's Behavioral Health Oversight Advisory Council and Montana state administrating agencies, examining gaps in child and adult services and recommending solutions when gaps are identifying potential additions to services within Lewis and Clark County for recommendation to local and state elected officials. And when identified, analyze and discuss local problems experienced by service providers, agency groups, public officials, consumers of services, and general public. Facilitate accurate and timely communications, assess the effectiveness of behavioral health services, and suggest ways of making those services more effective. When identified, serve as a catalyst and a facilitator in solving behavioral health service problems, and recommend strategies for organizing and coordinating services in our area. Work with behavioral health providers to provide education to the public on behavioral health issues. In 2021, the LAC's priorities will include advocacy for policies that will improve access to effective behavioral health services during the legislative session, strategic planning to enhance the outcomes for individuals who are struggling with mental illness and substance abuse challenges and are in need of community supports. We're going to continue to advance efforts around evaluating effectiveness, accessibility, and quality of community behavioral health services. Elevate awareness of the real behavioral health struggles through community outreach and communication. Identify gaps in services and work collaboratively with local and state partners to meet the needs of people who need these services the most. And implement universal screening protocols to improve access to care. And finally, work towards the design of a behavioral health continuum of care crisis system that meets the needs of residents of this county. Mental health is essential to a person's well-being, family and interpersonal relationships, and the ability to contribute to one's community and society. Mental disorders are health conditions that are characterized by alterations in thinking, mood, or behavior. They're associated with distress and impaired functioning. Mental disorders contribute to a host of problems that may include disability, pain, and death. Mental disorders are among the most common causes of disability. The disease burden of mental illness is among the highest of all diseases. In any given year, an estimated 18% of US adults suffer from a mental illness, and 4% suffer from a seriously debilitating mental illness. Montana has one of the highest rates of suicide in the nation. There is no health without mental health. Mental illness, such as depression and anxiety, affect people's ability to participate in health-promoting behaviors. In turn, Problems with physical health, such as chronic disease, can have a serious impact on mental health and decrease a person's ability to participate in treatment and recovery. Now more than ever, we must stand united to ensure those who are battling behavioral health challenges are met with compassionate, effective programs and services. At this time, I would like to introduce our panelists who will briefly outline various legislative priorities that will help to advance our joint mission to improve access to effective behavioral health services. And I believe that our first presentation is from St. Peter's Hospital.
Thank you, Drenda. This is Carrie Kaler, and I am the Senior Nursing Director at St. Peter's Health. And I am here just to talk briefly about a couple of programs that we are working towards. And one is the Mobile Crisis Response Team. We started this on November 2nd. The doors opened, I would say, quote unquote, the doors opened, maybe the car started. This is a service that is funded by a matching grant with the community, with the county and the state. And this provides mental health services in the location that the patient is. So this team will be dispatched and is dispatched out by 911. They respond to scenes with law enforcement and as just the security piece of that. And they are able to meet patients' needs wherever they are at in the community at the right time. This helps decrease ER visits and decrease prolonged wait times in the ER. A lot of these patients don't need to be seen by an ER physician. They really need the behavioral health piece. So we're really excited about this program, and so far off to a really fantastic start. Our goal is to have this service cover 24 hours a day as we continue to employ more behavioral health specialists in this field. The other items that St. Peter's Health is working on is payer alignment to increase billing capabilities for licensure candidates for non-FQHC primary care clinics. We have hired master's prepared licensure candidates who are unable to bill for their services. We feel it is important to continue hiring licensure candidates to support the development of our behavioral health workforce, but unlike FQHCs, we are unable to bill for these services. Coverage for behavioral health screenings without copays. There are billing codes that we can use for behavioral health screenings administered in primary care, but these are not covered by all payers, and many pass on their copay to the patients, which has led hospitals like St. Peter's Health to not bill for these services. Being able to bill for these services without a copay to the patient would help ensure that our behavioral health services remain sustainable. Also providing peer support coverage for non-FQHCs. Peer support is a vital component of behavioral health care, including addiction recovery. FQHCs can bill for these services to support this role, but as a non-FQHC, we have no way to fund these positions. Coverage for behavioral health services as preventative. These visits are currently covered as a specialist visit. We have primary care patients with commercial insurance who do not qualify for the patient assistance program. So they quit needed behavioral health services because they could not afford their $50 copay if they had traditional insurance, or $100 plus if they have HDHP. Covered behavioral health services as preventative would help patients receive needed care without the added stress of financial burden. We are also focusing on the increase of use of upstream resilience tools such as the PACS, which is PAX, Good Behavior Game in Schools. PACS is a set of strategies to help students learn important self-management skills while collaborating to make their classrooms a peaceful and productive learning environment. In 2019, Montana received a $2.1 million grant to implement PACS in the schools across the state. There is strong evidence behind PACS that supports its implementation in all schools statewide. We are also working to increase community-based care alternatives to meet people where they are. Continued support of the drop-in places such as Our Place and the Centers for Mental Health. Support of the workforce resilience training. So I wanted to thank you for your time and appreciate you listening to the items that St. Peter's is working on and would like assistance in. Thank you.
Thanks, Carrie. And I neglected as this morning's facilitator to to say at the very beginning that as per the agenda, we will do comments and questions after the panelists have had an opportunity. So if questions come up, please do use the chat feature. Down at the bottom there of your menu bar, there's a chat feature. Please put your questions there. We will take, of course, our legislators' questions first at the end, so that we're sure to get everyone's questions answered. All right, so we are going to move to our next panelist, representative from Shodair Children's Hospital.
Good morning, Craig Osvid here. Thanks for the opportunity to present. So here's what our priorities for this next year. And it's obviously the first one is protecting the community benefit or our nonprofit status. I know there's always noise about hospitals specifically being for-profit, and I think the work we do specifically at Shodair, we just need that nonprofit status protected. Medicaid expansion is first and foremost of everything we're doing. Without that, we would not have been able to expand like we have. So we have made a conscious effort of really taking services out to communities. So in this last year, through the use of Medicaid expansion, we opened a clinic in Missoula, Butte, and then by the first of the year, we'll be opening another clinic in Great Falls. And that is all attributed to Medicaid expansion. So just for everybody's benefit, Shodair took care of kids from 44 of the 56 counties last year. So it's important to us to be able to go to the communities instead of everybody having to come to Helena. So that would be very, very important. And then obviously Medicaid expansion allows us to develop other programs and services for the mental health care continuum. The other item is increasing access, and this is all about telemedicine. Obviously COVID was a jump start for us and many other organizations, but our ask of the legislators is that we continue the existing rules that were enacted during COVID. Also important to us is protecting the Medicaid provider rates for both residential and outpatient. We cannot continue to have cut upon cut, so that becomes important. And then finally, is expediting the licensing process for out-of-state employees. Is a lot of times we will get employees that will apply, we get them hired, and then it takes weeks and months to get them licensed in Montana. So that would be a summary of our priorities for this next year. And as Trenda said, I'd be happy to answer questions at the end. Thank you.
Thanks, Craig. Our next panelist is a representative from Aware. Oh, there we go.
Hello, I thought I was a couple more in line. My name is Matt Buney. I'm the CEO for Aware Incorporated. This is an impressive group of people this morning. Thanks for joining, and thanks for opportunity for Aware to speak. Aware is based in Anaconda, but we really deliver services across the state. In Helena, in Lewis and Clark County, in this Tri-County area, services that we provide are things like our PAC team program for assertive community treatment, adults with mental health. I call it that mental health hospital without walls. I think a lot of you are familiar with that. So with our PAC team, we also start with early childhood services. We run a Head Start Center out in between Helena and East Helena. We also couple mental health services along with that early childhood center. We also have CSCT, school-based mental health treatment, and what am I skipping? We would like to provide more of those community-based services like targeted case management, home support services for kids. Right now, with massive cuts from a few years ago, those are not operable for us. Hopefully they're going to be coming back soon. But as we'll get to in a minute, legislative priorities, these need funding. for us to do the funding for really preventative services. So on the list here, for us, I think a lot of the services we provide are those preventative in nature and step down. So people coming out of the state hospital, we're able to give them opportunities to be able to live and work and be productive members of society. In kids services, working very closely with CPS, Child Protective Services, and foster care system, really to help family training, family teaching, and helping those kids stay, as you've heard the terms, in school, at home, and out of trouble. Helena Kids, we also serve in many group homes. We operate about 45 group homes in other towns. We don't have one in Helena, but there are plenty of kids from Helena that when they do reach removal from the home, we operate those group home services in other towns. Some of the threats that I think we have really are in that funding. We're competing for staff. The limiting factor for us to be able to serve families and kids is staff. We would be able to greatly increase services and increase those mental health and behavioral health and developmental disability supports if we had those right staff. We end up competing with one another. We compete with the hospitals, FQHCs, mostly for those mental health clinicians. We're not on the same playing field as far as levels of funding. Opportunities that, as Craig described, telehealth, some of the changed rules with COVID that is Jumpstart has allowed us to reach out and stay connected with families through telehealth. I'd put that caveat on there that I think there still is that need for the chronically ill population that we serve to have that face-to-face. I think there's for intake, for assessment, there's still a face-to-face need and to be able to stay connected, but telehealth and some of the allowance and the rules have been very helpful. And I've got plenty more, but I think I got a time limit. So thanks for allowing me, and I'll be around for the morning.
Thanks, Matt. I also am pleased to represent this morning our Association of Montana Public Health Officials, Montana Public Health Association, and the Montana Environmental Health Association. We have just a few priorities this legislative session. We've been a little busy with a pandemic, so we'll be really focused this time around, specifically around maintaining public health authority, immunizations, and tobacco control and prevention. But I think most relevant to this particular conversation is really making sure that Medicaid expansion remains. It's very important that people have access to care, access to both medical care as well as behavioral health care. That contributes to a healthy community, and that's what public health advocates for. So those are our short list of legislative priorities this session. Thank you. And next we have a representative from the Behavioral Health Alliance of Montana.
Good morning, everyone. Nice to see you here bright and early on our Friday. My name's Pat Noonan, and I'm the Policy and Advocacy Director for the Behavioral Health Alliance of Montana. And Behavioral Health Alliance represents roughly 30 behavioral health and substance abuse treatment and prevention entities. And so we have a list of priorities. Some of them are things that could happen this session, and some of them are things that we would like to continue working on and just see change in Montana as more of a long-term goal. One of the things with the new administration change, we would like to work with DPHHS and continue our work trying to bring certified community behavioral health centers into the state. And so they're very similar to an FQHC, a federally qualified health center, except that they focus primarily on behavioral health. One of the important reasons for that is, as the previous speaker, Matt, had mentioned, there's a big disparity on how what rates are and what people are paid for on the service they do, and FQHCs currently have a substantially higher payback rate. And so by being able to create these centers for behavioral health, we hope that that would not only add care and expand access, but it would also make it so we can have more of these providers in the state that can be healthy and survive. We also have been working on trying to change the system to really do a systems of care for both adults and children. A system of care would really help streamline, be able to get services where people need them, where they're at in their home before they have to go to higher and more expensive levels of care. There's also the Family First Prevention Services Act, which doesn't require legislation, but it comes from the feds, and it should be at least starting to be enacted here in Montana in October. So we look forward to working with the new administration and whoever the new DPHHS director is to put some of that together. As we go into this session, the thing that's the most immediate in front of us, which all the legislators out here have heard this before, but we want to create a real sustainable funding model for behavioral health, and however we can do that. The bottom line really is what we're currently doing right now is we're running a We Already Gave campaign. And so many of the organizations, pretty much all of the organizations that BAM represents in 2016 took some really hard hits. There were some big cuts when revenue wasn't up. And many of these providers are barely hanging on and definitely could not sustain another round of cuts. So we lost, the state of Montana lost a lot of services in 16 and 17 where people had to shutter their doors, and rurally, or in rural areas, definitely lost care because it was hard on the current paying models to even keep those open and to find staff. And the cuts from 16 and 17 severely compounded that. And so we need, especially now more than ever, a very robust system for behavioral health and substance abuse treatment, and it needs to be accessible, and it needs to be a very healthy system. And right now, providers are making it, but it has been tough on the rates, and so it's only been made worse with COVID and with this pandemic. And so what the providers have to go through as being a frontline provider who's often overlooked. You know, we spent a lot of time early on in this pandemic, and we were giving kudos to nurses as we should, and we are giving kudos to everybody we could think of as a frontline worker, including people who would deliver your food. But people who work in the homes with children or adults who have a behavioral health issue are often overlooked. And they were very frontline workers who didn't really get the credit that I personally think that they deserve during it. I mean, we're talking about kids who live in a house, and you essentially are their family. They're frontline people who are in their house every day. And during this pandemic, it has made it increasingly hard to find staff, to pay staff an adequate wage to be able to do these jobs and to really sustain the system. And so I guess cutting to the chase, number one absolute goal in this session is we cannot sustain another round of cuts for our private sector providers in behavioral health. And of course, our next one is we would take any rate increases whatsoever if it is absolutely at all possible. Anywhere we would do it. So that is my presentation, with ending with begging. So thank you all.
Thanks, Pat. It looks like we have a poll, so we'll take a moment. Julie, I'm trying to follow your lead. It looks like we have a poll. The question is, what is your affiliation? And there are multiple choices there, so please answer the poll. And submit. And then we will go on to our next panelist. Our next panelist is Dr. Gary Mahlish from the National Association of Mental Illness in Montana. Gary? You might be muted. We're not hearing you. How about Matt? Are we?
All right, I'll get started and let Gary come in. I think that we have a lot of similar things that that we're pushing as everybody else. We have our group of legislative objectives, and then we're working on about 10 bills right now. So supporting funding is the main one. As everybody described before, we've had huge cuts in the past, and we need to keep going and supporting our system in order to be successful. We would like to improve transition services for children aging out of the mental health care system. We oppose solitary confinement in both the treatment and corrections systems. Also to require transition services from public health and correction institutions into the communities. One of the things that we're working on legislatively is an interim study with Senator Walt Sales to look at the current state of the system and where we need to go from there. We've had a lot of luck with interim studies in the past to change and work. I know Pat Noonan was a leader on a couple of those. So we believe with all the changes that have happened between the budget cuts, COVID-19 and telehealth, it's time for mental health to get another one of those. We also support research-based suicide prevention programs in Montana schools. We have a bill with Senator Edie McClafferty to fund those bills like PAC's good behavior game that was described before through alcohol taxes. So it would be repurposing the alcohol tax to allow for wellness programs. One of the ones that we're also currently working on right now, it's in the early stages. I don't know if it'll be ready for prime time, is we're in discussions with some folks about trying to fund crisis services through the marijuana tax. The challenges of crisis services and some of those wellness programs is they're not billable. And if CMS is not allowing people to bill for it, the state can only do so much. So we especially want to have long-term services that aren't billable covered by long-term revenue streams, and would love to have any support possible for that. So thanks everyone.
Gary, will you be adding to or just available for questions? Maybe just available for questions. It doesn't sound like we're hearing him.
Yeah, Drenda, this is Jolene. I tried to reach out to him and he's not responding. So he must not have connection where he's at. Thank you.
Or he had to step away from his computer this morning. Okay, thank you. Our next presenters, our representatives are from the Montana Primary Care Association. Stacy?
Good morning. Thank you, Drenda, and what a great group this morning. So the Montana Primary Care Association is the association for Montana's community health centers. So those would be the FQHCs in the state, as well as 4 of Montana's urban Indian centers. And we have a number of buckets of work that we really focus on. And this year, we're sort of really trying to hone in on some key things. Obviously, the number one thing we really want to work to do is protect Montana's Medicaid expansion program. For the purposes of this group, I think it's helpful to remember how much Montana Montana's Medicaid Expansion program expanded access to mental health services and substance use services. So if you look at the DPHHS dashboard this morning, over 47,000 Montanans received outpatient mental health services under expansion, 4,600 received inpatient, and then over 12,000 individuals received substance use services as outpatient, and 4,000 received inpatient substance use services. So Medicaid expansion in the context of mental health and substance use is so critical that it really rises to the top of what we're doing this year. We also have improved access to telehealth services. Jill Steely is on, so I'm wondering if Jill, if you could just weigh in a little bit about the importance of telehealth during the pandemic.
Sure. Yeah. Hi, everyone. I'm Jill Steely, CEO of Pureview Health Center. We're the federally qualified health center here in Helena, East Helena, and Lincoln. Since the pandemic started, we implemented telehealth, both audio and video, and just by telephone for all of our services. But it is by far used primarily the most in behavioral health. So I just wanted to give you some statistics. Since March 15th, we have had 2,774 behavioral health visits. That would include case management, mental health, so prescribing and therapy, substance abuse services, and peer support services. Of those, we have done 26% of that 2,700 visits by audio and video, and 22% of them by just phone. We really feel that it's been a very critical way for people to access services during the pandemic, but we also want to make sure that it keeps going once the pandemic is over, because it will be over someday. And people still need access to services outside of the pandemic that isn't just coming into the clinics. Thanks, Stacy.
Great, thank you, Jill. And so the other two strategies and things that we're looking at are dealing with some of the workforce shortages that we're all facing. And those include training and scope of practice and licensing barriers. And we have a couple of bills around that. And then we also do a lot of work on improving health equity through legislation. So you can think about housing needs, food security, transportation barriers. And, just as an example, Pureview itself in 2019 had over 500 patients who receive some of these coordinating community services that we call enabling services that get to the social determinants of health issues. So we're available for questions, and we're happy to answer any questions you might have.
Thanks, Stacy and Jill, for being here with us this morning. Our next presenter is from the Central Service Area Authority. Matt.
Good morning, everyone. My name is Matt Furlong. I am the Vice President of the Central Service Area Authority. First of all, I'd like to thank the host and all of those in attendance for taking time out of your morning and your day to be here. For those of you that are not familiar with the Central Service Area Authority, CSAA, we are a board of stakeholders established by statute to collaborate with DPHHS for planning and oversight of mental health services within our service area. Our mission is to ensure that consumers, their families, and community stakeholders have a strong voice in developing, managing, and monitoring the public mental health care delivery in Montana, with a focus on the central region of the state. The primary objectives is to ensure that consumers' needs and preferences are at the center of the services provided. The Central Service Area Authority is the conduit between the local advisory councils and DPHHS. The central region represents 15 counties, which include Lewis and Clark, Broadwater, and Jefferson. The CSAA and LACs are required to maintain a majority of at least 51% membership of the consumer and family members. This ensures that the consumers can participate in collaborate, coordination, and delivery of mental health services. The CSAA has been a strong advocate for a consumer-driven, family-centered, and recovery-oriented system of care. NAMI Montana and the Montana Peer Network have a strong consumer voice as well. The CSAA has seen how their education, advocacy, and peer-to-peer support have improved the lives of consumers across the state. the CSAA strongly recommends NAMI Montana's legislative priorities. Along with today's presentation, I have provided an attachment as part of today's presentation. Page 1 explains the CSAA in more detail, and page 2 has needed support that can be provided by legislation. We believe these recommendations are tangible requests that can direct funding and changes in laws to deliver consumer support effectively and sustain what is working well. So as you consider legislation and policy in the coming session, we would like our community service providers, policymakers, and lawmakers to seek consumer and LAC input during the planning process in relation to mental health decisions. We would like to see the legislative session address our provider shortage and deliver changes to decrease the wage gap between Montana and other states, and to balance the large gap between state and private provider wages. Now, last of all, to invest in increased community mental health education to reduce stigma and the fear of the words mental illness across our state. So thank you for your time and to all the work you all do for decreasing the ripple effect of mental illness and substance use disorder. Thank you.
Thanks, Matt. Our next presenter is a representative from Elevate Montana, Helena affiliate. Rebecca?
Good morning, everyone. I would like to thank all of you for being here this morning and giving me the opportunity to talk about a very simple but powerful program called Handle with Care. Our priority, we're a collaborative in the Lewis and Clark area. We're a collaborative that focuses on adverse childhood experiences. And Handle with Care is a great program that came out of West Virginia's Children's Center for Justice, and it has spread all across the country. So when law enforcement officers or other responders are involved in a potentially traumatic incident where children are present, but it's not, they're not victims of crime, or there are no referrals to Child Protective Services. They collect the name, ages, and schools that the kids attend. And then before the next school day, a report is made to the schools that says, Johnny Smith, Handle with Care. No other details are included in the notification. And here is a flow chart on how it works. In Montana, Polson started this program 5 years ago, and it has been very successful. Other schools that have come on board, or communities, are Conrad, Libby, Power, Kalispell. So what has happened is a group of supporters have gotten together, and we've been working on a bill. So a draft was drawn up this past year, and in August, the Interim Education Committee voted on the bill, and they have agreed to carry the bill this coming legislative session. So they're going to introduce it. What we really want you to know is that it will not be mandatory, but it gives you all the steps that need to happen in the schools. And this allows communities and law enforcement, it erases any questions about privacy or confidentiality. So the other thing I want to say is that it mitigates. It's a powerful tool because it's proactive, and it's about mitigating the effects of trauma. So it creates connections. It creates connections between the schools, law enforcement, first responders, and then it also creates connections in the school with the kids. This is not punitive for the kids. So in the long term, it reduces the need for kids to start risky behaviors, for seeking out drugs and alcohol, even mitigating suicide, and provides connections with the teachers in the schools. Also, there's no cost, and our schools have all been training on the good behavior game. A lot of them have had ACEs training. We hope more schools will invest in adverse childhood experiences training. And then they also have the CSCT programs in the schools. Thank you very much, and I hope that you will investigate Handle with Care further and think about supporting the bill. Thank you.
Thanks, Rebecca. Next, we have representatives from InStar Community Services. Michael?
I know, but I got on YouTube. Good morning. Can everyone hear us?
Yes, we can hear you. Thanks.
Good morning. I'd like to thank everybody for allowing us this opportunity to speak on a few of the issues we would like to see the legislation provide some services for. The first I'd like to hit on is that peer support needs access to the block grant for the substance abuse prevention and treatment, so that we can have direct peer-to-peer support during crisis situations from Medicaid. Our other thing we'd like to talk about is funding for housing. Funding for housing for recovery facilities. And we run a national alliance for recovery resident level housing.
Michael, I'm gonna stop you just real quick because your presentation is really important and we're not hearing you. You might need to step closer to the computer.
Can you hear me now?
A little better.
Okay. Should I start over?
No, now we're losing you again.
Okay. So what we would like to talk about. Okay. Is that better?
Yes, that's better. Thanks,
Okay.
Michael.
So hello, I'm Michael Cardi. I'm from InStar Community Services. I'm here with Terry Russell. And we would like to talk about substance use disorder and access to services. One of the issues we would like to talk about is for Medicaid to provide funding for us to have access to the substance abuse prevention and treatment grant, so that we have direct contact and person-to-person support for people in crisis situations. We are also hoping for funding to be provided for recovery houses. We have been running a NAR level, which is the National Alliance of Recovery Residences, for a year now, and we find funding problems with that. We have also just recently opened an approved level 3.1 substance use disorder treatment facility for veterans and others in the former Willis Cruz House. And we are going to be, it's on Leslie Street, and we are going to be naming it the John Scott Hannon Home, who was a commander for the Navy SEALs. He was a former SEAL commander who died by suicide in 2018. We haven't found a lot of funding sources to help with SUD recovery housing, which we find to be a big need in the community. Our last point, of course, is Medicaid expansion. We support that. And also we're hoping that we can find a funding source for a detox center, which is a huge need in this community.
That's on our dream list.
Yeah.
And then I'd also like to add, I would So we're having outside companies with this telehealth movement. I want to make sure Montana legislators protect Montana clinicians, that it's just the Montana clinicians, that these outside companies can come in and provide services, but are they monitored? Are they credentialed? Like, who's coming into our state? Who's allowed to do telehealth and who's monitoring it? I guess is what I'm trying to say. And I'd like the preference to be for Montana providers and clinicians only. I think that's it.
Yep.
Short and sweet.
Thank you very much.
Thanks, Michael and Terry. And next we have a representative from the American Foundation for Suicide Prevention. Jen?
Good morning and hello. If we have not met, my name is Jennifer Preble and I am the Policy Advocacy Chair for the Montana chapter for the American Foundation for Suicide Prevention. Many of you will see that abbreviated AFSP-MT. I am also pleased to serve on the National Public Policy Council. With the few minutes I have today, I want to echo many of the remarks made from my colleagues, including the emphasis on statewide and comprehensive crisis services. A big focus should be funding for the 988 designation hotline to replace the National Suicide Prevention Hotline effective in 2022. Your fellow lawmakers passed this amazing legislation earlier this year. However, funding will not go far enough for our local call centers to staff and maintain these offices and allow calls to be answered locally. You can enact a law to add a 988 designation fee to phone bills to fund those crisis centers and National Suicide Prevention Hotline that is very similar to how 911 is funded. Additionally, AFSP always encourages and supports increased education on mental health and suicide prevention for K-12 teachers and mental health professionals. Montana has some requirements, however, we can always strengthen those requirements. Our chapter has volunteers across the state committed to providing resources and educational material to you and your neighbors regarding best practices for comprehensive suicide prevention. Please feel free to reach out, contact me, and I can get you in touch with any volunteer or member of our chapter.
Thanks, Jen.
Yes.
And I believe what we have next are a couple of polls for our members to participate in. So here's the first poll, and please respond. Okay, just wanted to give everybody an opportunity to participate in the poll. Now we're going to go to question and answer. And Jen, will you be able to facilitate our question and answer today?
Absolutely, thank
Great.
you.
Yep.
So again, just a reminder to please put your questions in the chat box and then we can all see them and I can direct them. If you have it for a specific person, like for AFSP, for example, then please indicate that. Otherwise, I will do the best that I can to get that to the right person. One of the questions that I've seen so far, and Matt Kuntz, I don't know, maybe you might be the best one to answer this with not me. There's a couple bullet points regarding mental health in our correction facilities. And I see also that Matt Furlong just messaged something about that as well. In opposition to solitary confinement, transition services from the justice system. Can you explain if that is a funding issue, staffing issue, or how we could tackle that?
So I think that there are a lot of different angles to tackle these issues. And I'm sorry, another poll thing came up. You know, it really does depend on the town for what treatment is involved. What we're looking at on a state level for solitary confinement is a little bit more of looking for legislation to require less invasive care. But I'll be honest, with COVID, that was one of the things that we haven't developed significantly yet this year.
Perfect. Thank you, Matt Furlong. Anybody else want to comment on that before we go to the next question? Okay. From Representative Dunwell, let's talk about Medicaid expansion. What might happen to threaten it in this session? I'm trying to think, maybe Stacy, why don't you start us off, and then we might see if somebody else can help answer.
What might happen with Medicaid expansion was the question. So there's been a few wrinkles in Medicaid expansion that we're sort of walking through. Obviously, the change in the legislative makeup is concerning. It took a very careful coalition in 2019 to reauthorize Medicaid expansion, and we lost some of those important voices. That being said, we still have some great champions in the legislature for Medicaid expansion. I think the concern is one, about the funding, right? We're in an interesting funding space and revenue space for the state of Montana. And we've heard some legislative discussion about further tax cuts that'll put even more pressure on existing programs. So Medicaid expansion is in House Bill 2 this year, so they could do sort of a blanket cut to the state's share of Medicaid expansion that would require cuts to some of the optional services. This administration could consider submitting a new waiver that meets the original authorizing legislation in 2019. I think there's a lot of things that are possible in 2021 that could affect Medicaid expansion. And it's just something we're keeping a very close eye on, and we're in close contacts with some of our champions on this, just because it's a moving target. I don't know if any of the legislators want to weigh on this as well.
Okay, thank you, Stacy. That might come back around. We'll see. Let's handle with care draft. I saw Mafi, you were able to answer that for the LC number. Do you or Rebecca want to just give another quick synopsis about that, or what the legislation actually looks like for some of those questions coming in?
If people want me to, it really is a good program. I know that people, their first reaction is thinking that we're circumventing Child Protective Services. That's not the case. This is not for something for which the child is a direct victim. It's say they were in a car accident during the night or the night before, or perhaps a parent or a grandparent had a heart attack and was taken away in the middle of the night in an ambulance. Those are things that are traumatic. And this is just to notify the school. They don't know what happened. All they know is that the child might not be quite his or her usual self that day, and to just give them the space and support if they want to, maybe they need to see a counselor, but maybe they just need to go sleep someplace and have a little bit of extra TLC. And that's what this is about. It's to give them the support and comfort after a traumatic incident that they are not a victim. They are not this is completely separate from Child Protective Services and the things that have to be reported by the police. Does that help clarify?
I think that's great for now, and then we can certainly follow up after this call if we have more questions on that. Thank you. Could Craig tell us more about legislative audit that may jeopardize nonprofit status for our hospitals? Craig, are you still with us? I am not seeing him. Let's see. Stacy, do you happen to know anything about that?
Could you ask the question again, Jennifer? I was texting and I'm sending an answer to Representative Farrell.
Yeah, sure, no problem. Do you know anything about the nonprofit status for our hospitals for Shodair, or maybe even Carrie might answer?
Yeah, Carrie might know that right off the bat. I'll wait for her to weigh in. If not, I can say what I know. Okay.
Sorry guys, just trying to do I am not aware of what that is. I'm sorry.
Okay. So in the 2019 legislative session, there were some efforts to sort of take away the nonprofit status of Montana's hospitals, which would have put quite a tax burden on them in terms of their property valuation. And you can imagine how that plays out on and sort of their tax liability. There are a number of bill requests this year that also get to the heart of hospital nonprofit status and also their community benefit, I guess, calculations, how they give back to the community and how that's measured and how it stands up against their nonprofit status. And I think the biggest concern is when you start challenging nonprofit status of hospitals, you have to remember that a ton of hospital resources are what supports Medicaid expansion. And I think that's the delicate balance we're walking, certainly as allies of hospitals. How can we be helpful in connecting the dots that when some sections of the legislature really go after the big hospitals, that it jeopardizes a major program for healthcare in Montana.
Perfect. Thank you, Stacy. And I see a couple of questions and some answers in the chat about behavioral health professional licensing and expediting that. And I'm just wondering, maybe even Pat, if you have any further comment about what legislation could look like and how do we expand our workforce? Do any of you local behavioral health CEOs want to tackle that? I'm thinking even BAM representatives, Matt, Sydney.
One of the ones that we've heard a lot of complaints about from the VA psychologists is how hard it is to come to Montana as a psychologist. We have very different rules than other states that arguably were designed just to keep out-of-state psychologists in other states. So I know that that's a real challenge. When I went to my VA appointment and when my provider found out that I worked in mental health, that was the first thing that they said was we come here and then we can't move into the community because the federal laws trump the state laws for the VA employees, but it doesn't allow them to go work at Shodair or work at some other place. So we've set up a set of rules that make it very hard, first for the VA to recruit psychologists into Montana. And now that they've been doing a better job to do that, it makes Montana a harder place for those psychologists to stay. And one example of that was there was a psychologist at a amazing trauma center for veterans just outside of Bozeman that really had trouble getting her licensure to transfer over. And it was purely because we have some older and arguably outdated laws in comparison to other states. So that, but it is hard because the VA can't advocate for this, and those psychologists don't really have a voice.
And if I could add to what Matt said, we are having difficulty in recruiting even just LCPCs into the mobile crisis unit from people from out of state. We have not been able to actually employ 2 candidates that were interested in coming here because of licensure issue and that they could not transfer their license. And it was, and I don't know all the specifics to it. I'm really sorry, but it has prevented us from being able to hire people from out of state as well.
And Stacy, you wanted to add to that?
I'm getting all jumpy because this is one of our bills. We're going to try another bill this session. We tried it in 2019 and it got easily through the House and then hit a roadblock in a Senate committee. But Frank Garner from Kalispell is going to carry a bill that permits the Board of Behavioral Health to have rulemaking authority that allows them to look at out-of-state licensed candidates who have years of experience but might be missing one or two educational requirements that are required under Montana law. And they'll be able to develop rules that allows those experienced candidates to get licensed in the state of Montana. The Board of Behavioral Health does not have that authority. There are several boards in Montana that do have that kind of authority, but the Behavioral Health Board is not one of them. And so we're hoping that will help with some of those hiccups, not all of them. Like, it's just it's like evolving. Some of these are evolving licenses, so they take continued scrutiny. But that bill, I think, is one that might help with some of those out-of-state candidates.
Thanks, Stacy. And Carrie, did you disappear? There's a couple more questions I wanted to get back to you on.
I'm here.
Hi. So there was a question earlier about what, let's see, the numbers, mobile crisis numbers. Do you have any early ones from St. Peter's? I know that I can just say there's mobile crisis teams across the state, and there might be somebody else on the call that can give data from a longer period of time, but that was directed at you. Can you speak to that?
Yep. So our preliminary numbers for the month of November, so we were open 28 days. We saw 28 patients. We avoided 19 of those patients were kept out of the ER. 7 of them ended up having to go to the ER after the evaluation in the community, but so about 68% were able to stay out of the ER and out of detention centers. And almost all of those were, all but one were actually referred either by 911 or law enforcement on a scene calling mobile crisis directly.
Perfect. Thank you, Carrie. Pat, are you available yet? Pat Noonan?
I'm here.
Hey, can you,
do
you have any information about other statewide mobile crisis response teams? And the other question that's been directed at you, how can legislators help create a sustainable mental health funding system?
You know what, there's probably somebody better out there to really get specific on mobile crisis. I'll fumble my way through that answer on the specifics that you're looking for. As far as sustainable funding, I think that the legislature is going to have to take a hard look at all of the possible options. Obviously, any new tax revenue, hint, hint, coming in could definitely help at least keep some of these services funded. I think that to get to a full sustainable funding model is going to take some work and probably more than one legislative session. But I would say for going into this session, I think it would be very important to really look at the core services that make up behavioral health and make it accessible in communities and make sure that those are adequately funded. And so we at least have a system to build on and a system to actually talk about ongoing sustainable funding, as opposed to having a system that is stitched together and just kind of limping along as best as it can to get through.
Anybody else have a comment on mobile crisis?
I do. Not just on mobile crisis. Hi, I'm Kim Gardner. I'm the clinical director at Intermountain Children's Services. We have programs across the state, but I think Carrie has highlighted it, Matt has highlighted it. We cannot find staff, and the reason we can't find staff is because we cannot compete because our rates are so low. So recruiting staff into Montana, I like what Instar said from Terry from there about we really want to hire Montana residents. We're not opposed to out-of-state residents. Great if they'd like to serve here, but the ability to hire and pay the wages of therapists and attract them is very difficult because our rates are so low, and they're low in residential centers and hospitals and outpatient centers. And so it's very difficult. And FQs can pull down a higher reimbursement rate, but still there is a staff shortage of that. And so even if we improve our ability through the Board of Behavioral Health to recruit out of state, any of that, that's not going to greatly help, because the rates are so low that we can't afford to hire them. And so I don't know if that's helpful, but we keep talking about rate cuts, but that is what killed off. We don't even have an inpatient adolescent treatment center for substance use in Montana. So if any youngster needs inpatient treatment, they have to go out of the state for that. And we used to have several, and they were fabulous, but they had to close their doors because the reimbursement rate was cut so low that they just could not afford to keep the doors open. So that's only one example, but and also on the Board of Behavioral Health, they've done some rapid fire easing of the rules to attract just during COVID and endorse out-of-state licensees to operate in Montana during the emergency, but that exception will end. But most of them will already qualify easily to maintain their license. They would anyway. They would just have to reapply. So they've done some things temporarily to ease that and attract more providers to do telehealth into Montana. So I think that's key. And then part of the legislation of sustaining the ability to bill for telehealth services and telephone services for all of those remote communities, and even in cities and towns where people could drive to the provider, we do in-person services, many of us do. But still, there's a lot of people who just cannot come into our services. And if we don't sustain the ability that we recently got through COVID to bill for telehealth and telephone, that's going to greatly impact workforce and the access to mental health services.
And Kim, I think that's great. You pick up on a couple of points that have come up through the chat as to what telehealth and telemedicine services look like post-pandemic with CMS. Does anybody know what is outlined there right now, or what we need our legislators to do in order to continue allowing for those services, or what's funded?
Pat may be able to answer this better, but I know that the Behavioral Health Alliance is working very closely with the department, and all the agencies are. We've all submitted our data on the number and the far-reaching impact that we've been able to provide for telehealth and telephone services. And the department has been grateful for that data so that they can appeal to CMS and ask for continued coverage. But I don't know, maybe Pat does, about the likelihood that will happen.
I would also weigh in here a little bit, I don't know if Pat's out there, is that some of the discussion of the next COVID relief package, or the next COVID relief package, is to make what I've read is to extend those telehealth provisions for 5 years, was sort of the last language I saw, that it would push it back out. So that would be great. And there is also a bill that we're working on in coalition with BAM and the hospitals that does some of the telehealth provisions in Montana for all payers. So that's what I know.
This is Sydney Blair from the Center for Mental Health. The thing that I'd love to see, I'm a proponent of, expanding telehealth. I think that we need to have some strong policies around that. And I think it's been touched on already, but it's really around protecting Montana providers and that continuum of care that exists now, as well as expanding access at the same time. So we're seeing a lot of people want to come in and provide those services from out of state, and it kind of threatens some of the programs that are already in existence. And is there a strong handoff or coordination of care with everybody else? That's kind of the issue as I see it. So I think just kind of as we move forward, carefully kind of considering how we're going to address that, and what are we going to put in place that really protects those Montana providers and their care. And how do you audit those kinds of programs out of state in the same kind of way? I think that's kind of a minor issue, but I'll just throw that in there.
Yeah, those are all, this is Pat, those are very good comments. I don't have much to add except that yes, the telehealth has been very important. It has definitely helped with access. It has especially helped people to be able to receive services in rural areas where they might not have a bricks and mortar provider right there. But we also want to be very aware of making sure that they're good players. And so it's a lot easier to prove that our providers here in Montana are good players just with the numbers of audits they go through and the types of quality assurance that happens just to be a state provider. And so we would hate to have any kind of predatory out-of-state providers show up and take advantage of this telehealth, which then possibly could ruin it for everyone.
Hi, this is Mary Cafaro, and when you're finished with the chat box, could I please ask my question verbally? I'm challenged because I'm on my phone and I can't really see the chat box too well, so I think my question is confusing. Thank you.
Perfect. So I think we've touched a lot on the Medicaid expansion, but I think that there's a great example and about unintended consequences. And I'm not sure if anybody has a real great answer, but the example is thoughts about unintended consequences of Medicaid expansion asset test. So 500 people who are victims of this, like one woman in Bozeman who owes the state $10,000. She owns her home free and clear. That's her total asset. She earns $17,000 a year and has 2 kids, now can't get health insurance. The exchange says she earns too little and Medicaid won't approve her because of her home asset. Stacy, you're shaking your head, so I'm going to put you on the spot first.
Boy, I know just enough about this to be dangerous. So it's the taxpayer integrity fee that comes out of the Department of Revenue. And it's not called an assets test, but it is an assets test for individuals who are enrolled in Medicaid expansion. And yeah, that's what I know. I think we're still grappling with how we manage that because some of the bills that individuals who are on Medicaid expansion are getting are mind-blowingly big. And you know, when you earn $17,000, there's no way you can pay a $10,000 taxpayer integrity fee. And most of it goes back to someone having a house with value in it, which if you think about how our houses have been valued over the last couple of years, I mean, if you have a house in Bozeman, what used to be, you know, a $200,000 house is now a $500,000 house. And the question we need to ask as policy people, whether you're a policy maker or a policy wonk, is are we really going to ask people to sell their home that they're raising their children in to have health insurance? And so I think that's something we need to grapple with. I don't know if there's a legislative strategy to deal with this. I know we're trying to talk to the current governor's office about the situation, but our time is running short with him.
This is Marianne. I'd just like to add, this woman is a widower, and the only thing her husband left her was his life insurance, so she paid off her home, and she just doesn't know what to do. She owes $10,000 and she earns $17,000 a year. And you know, I talked to a friend of mine at the Department of Revenue who I used to work with, and I asked, "Have you found any fraud and abuse?" And she said, "No, but we found 500 victims just like this woman." So I think we need to tweak this. And I guess I wonder what the wisdom is to open up Medicaid expansion and try to fix this, or what. But I guess, Stacy, what you're saying is you're working kind of behind the scenes with the governor's office.
I'm not sure it's really behind the scenes. Like, we're trying to craft a letter to see what might be done with the last days of his administration, but then we probably might also have to look at that taxpayer integrity fee and bring some of these stories to light, because it's really devastating to these families.
This is Mary Capero, and I'm going to jump in here as I think some people are getting 2 questions, so I want to get mine in. And again, I'm sorry, I can't see the chat box, so I don't know what's happening. But my question is, Governor Bullock's budget is fully funded, and he funds services with the Budget Stabilization Fund. And there are increases in services in senior long-term care developmental disability services, and mental health services, as well as Medicaid expansion is fully funded, as is Title 10, and preserved because it's going to be up for vote this time. And so it's funded, like I said, with the Budget Stabilization Fund, which is a formula that we put in place for these exact situations when we're short and there's short on revenue. I'm wondering if there is a strategy to publicly call attention to the current budget as a way to contrast it with the governor-elect's budget, which is the probability of there being cuts is really high. And I doubt there will be any increases from what he has said publicly. And so I'm wondering if there's any strategy to address that and use it as a way so that legislators can then use that as a launching pad to fight cuts or even to fight keeping status quo as far as funding, because obviously we need more money for services, even to sustain current level. Thank you.
Mary, this is Pat. You know, that's a very good question. I don't know that that I'd be prepared to answer to exactly what the strategy would be to compare and contrast both of them. But I do believe what's been put forward in Bullock's budget is really just recognizing the importance of these services and how badly we need them. I very much appreciate that those increases are in there, and I really hope that those increases stay. I hope that the incoming administration takes a look at that, doesn't look at it politically, and just understands that as we're getting to the other side of being a year in this pandemic, that needs for mental health services and substance abuse services are only increasing exponentially every day that this continues.
Thank you. I appreciate that, because legislators are going to need, and I'm on the Appropriations Subcommittee, and so far there's 2 Democrats and a lot of Republicans and new people who don't know the budget. And so legislators really count on good people like all of you to help us and do your good work to support those of us who are friendly to the issues and care about them and always have. So thank you for all of your work, and I appreciate the answer.
Thanks, Mary. Anybody else want to touch that?
I'll say something on that. The incoming governor has a number of transition teams, and I don't know if there's a way, if somebody knows 1 or 2 of them that are on the transition team, to discuss some of the needs around Medicaid expansion. So when they're implementing the incoming budget and DPHHS support, those things can be addressed during that time.
Thank you, Matt. There was a couple of comments about certified community behavioral health clinics. Pat, you had answered in terms of there may not be anything for legislators to do, but any other comments about how that funding mechanism looks in terms of Medicaid expansion, including, excluding?
This is Pat again. I was just answering Rep. Dunwell's question, and I know that 21 states have already created them, and I could be wrong, so anybody out there who wants to correct me, please do, but I don't believe that it needs legislation. I think that we can work directly with the Department of Public Health and Human Services to really be able to set up a system that we can put this together. And so.
Perfect, thank you. Our questions are slowing down, and we do have one more poll that we're going to have you do in terms of my kind of closing remarks as we near towards the end. And certainly if you have any more questions, pop those in and I will try to get to them before we sign off for the day. But I just want to say thank you to everybody. I think that has been well referenced in our chat box and from each of you today, as each of us are vitally important to the behavioral health workforce. You've been introduced to several topics, and we've had really great enriching conversation on how we can champion these initiatives and work throughout the 2021 session. We also all recognize this will be unlike any prior sessions, knowing that we're COVID and new administration and lots of transitions. So again, just kind of a reminder, broad categories: crisis services, Medicaid expansion and protection of that, provider funding, funding rates, as well as getting some of our outer state licensed providers in state and looking at removing some of those barriers. And then of course, mental health training, education, suicide prevention, those upstream approaches, as we talked about, like PACS behavior game, those handle with care laws, and many of these already have draft legislation. So lean on each of us to get some of those on your radar. Thank you again for the time and attention, especially thanks to all of the volunteers that made this morning possible, and for each of you getting up so early. Any other final thoughts? Thank you. Happy holidays to everybody from our planning crew, Jolene. Anybody else final thoughts? I think Brenda popped off already.
I just want to thank Jennifer and Jolene for all their work in putting this together, and Brenda coming in, knowing what her schedule is probably looking like. It was really appreciated. Thank you.
Absolutely. Right back at you, Stacy.
Thank you, everybody.
Have a great morning and a great weekend.
Thank you.
Happy holidays, everybody. Thank you.
Stay safe.
You too.